Hello, everyone, and welcome to this audio podcast. This audio podcast as part of an Interlobular branch edition, and this audio podcast as part of a SZtorm Communicade, and this audio podcast as part of a Squadron G-Force, and this audio podcast as part of a SZtorm Robotics production. This audio podcast will look into some of the guidelines around HSP, some aspects around the guidelines around HSP, and around the sort of laboratory practices, and around the laboratory some of the laboratory practices in as part of the as part of the guidelines as well, as part of the guidelines. So biopsy and histological lesions of HSP nephritis have been grouped by the International Study of Kidney Diseases in children classification into six categories. Six categories, one through six. And according to the presence and number of crescents. There is, however, a lack of consensus regarding the utility of crescents as a long-term predictor. Some studies investigations have shown that a high percentage of crescents predicts adverse renal outcomes, whilst others have not. Therefore, there is a requirement for a reliable, proven biomedical practice that can support both the development of HSP guidelines and support for clinicians to make more accurately formulated care plans for patients with HSP nephritis. In a systematic review, it works sort of retrospectively. Children and young people were followed up with HSP and found to have excellent overall renal prognosis. The review and the review had examined different lengths of follow up after the initial presentation of HSP, and showed that only 21 patients or recipients, which accounted for just under 2% of the total study population, developed subsequent renal impairment. Follow-up with urinalysis and of urinalysis and an ABP was recommended. ABP monitoring ABP monitoring or measurement was recommended. However, the ideal duration to follow up was unclear. In more retrospective works, it was revealed there was a revealed a favorable short-term prognosis of initial renal impairment in most HSP patients, with complete resolution of around 94% in pediatrics or young patients, and 89% in adults or young adults or adult patients at an average of 18 months follow-up. In amongst a sort of more literature, there is have been more works in around some of the guidelines around HSP, and so as part of this audio podcast, there will be a link to some more some guidelines, some aspects around some further aspects around the HSP guidelines in amongst this audio podcast, where listeners can check out the guidelines in some more sort of depth. depth, in some more depth. That draws this audio podcast to a close. This audio podcast has been part of an interlobular branch edition. This audio podcast is part of a SZtorm Communicade. This audio podcast is part of a Squadron G-Force, and this audio podcast as part of a SZtorm Robotics production.